Good evening to all of you. Myself Dr. Mansoor Ahmad, and I am professor in Chikitsa department, and I am working in IIMT University in IIMT Ayurvedic Medical College. Now my topic is motor neuron disease. Motor neuron is just like brain cells which carry signals from the brain and sensory system and to control the voluntary and involuntary system. Now come to the slides. First is motor neuron disease. Now I am telling about describe the first of all point is a serious and incurable form of progressive neurodegenerative changes. Means it is a serious problem, motor neuron disease. If there is any disease of motor neuron, then it is fatal. Now next point is a very rare condition that affect the nervous system. And it will affect the nervous system, can affect patient of any age, but commonly after the age of the 40. Means ये किसी भी patient या कोई age limit नहीं है, लेकिन mainly क्या है, ये ज़्यादा affect करता है above 40. Now the causes, what are the causes of motor neuron disease? How the disease is developed? Now first point, it is not sure why motor neurons start to lose functions. मीन्स ये अभी श्योर नहीं है कि मोटर न्यूरॉन्स स्टार्ट टू लूज फंक्शंस. फॉर एग्जांपल बहुत सारे न्यूरॉन्स होते हैं जो इनको अफेक्ट करते हैं, जैसे फॉर एग्जांपल डेड हो गए. बहुत सारी कॉम्प्लिकेशंस होते हैं, जैसे फॉर एग्जांपल आपका हाइपरटेंशन की वजह से हो गए डेड, या फिर कोई ऐसी चीज़ हुई जैसे क्लॉटिंग हो गया. नेक्स्ट, सेवरल इंटर रिलेटेड फैक्टर कॉज मोटर न्यूरॉन डिजीज इंक्लूडिंग एक्सेस ग्लूटामेट. Glutamate is just like a fatal neuron, means dead neuron, degenerative. Next is the lack of antioxidant production, means we are not taking antioxidant products just like fruits, and those will enhance the memory of the brain. Third is abnormal mitochondria of motor neurons. This is the important one. Abnormal mitochondria of motor neurons. Next. What are the risk factors? First is smoking. There are a lot of people who are doing smoking just like a chain smokers. Second is head injuries, especially repeated ones. Next is exposure to pesticides. These are the pesticides affect mainly the farmers. Exposure to some chemicals such as formaldehyde. Next. Now the motor neuron is divided into three stages: the initial stage, advanced stage, and the end stage. Clinical features of the initial stage. Now I'm telling the clinical features. First point, the patient grip weakness. Means there is suppose there is a weak of cogwheel rigidity. Now sometimes picking up and or holding things can be difficult. Just like in the case of Parkinsonism, there is a motionless face. Next is fatigue. I think everybody know the fatigue, muscles pain, cramps. These come under the deficiency of methylcobalamin. Muscles twitches, slurred speech, weakness in the limb. Next. Now the secondary symptom, insomnia. Insomnia is there is a less sleep. Depression. This is a major problem of lacking the motor neuron. Depression, stress, anxiety. Next is clinical features of advanced stage. Now the first, limbs became progressively weaker. Means these are the limbs which are progressively, we have to move just like we have to identify by these things. Limb muscles start to shrink. Means there is a shrinkage. Third, movement in affected limbs became progressively more difficult. This is the important one. Movement in affected limbs became progressively more difficult. Next, some limb muscles became abnormally stiff. Spasticity means there is a stiffness. We can say that in Hindi is a jakadan. Now, pain in the muscles and joints, this is a common problem. Progressive dysphagia, difficulty to engulf anything. Drooling, speech problems, dementia, breathing problems. There is some dyspnea. When we will go to some time, there is a feeling difficulty to breathe. Next, clinical features of end stage. The patient body will eventually become totally paralyzed, just like quadriplegia, paraplegia. These are the things which can affect the body. Breathing difficulties was and became serious, like the patient is come under the respiratory failure. In the respiratory failure, there is a chance of collapse of lungs. Next, as the problem worsened, the patient became increasingly drowsy and dies peacefully. Next, treatment. There's a lot of treatment according to Ayurveda. First of all, we can use the Shirodhara, Panchkarma procedures, and lot of internal medicine we can use according to Ayurveda, according to symptoms and disease. Now, the treatment for emotional lability, for example, antidepressant. For example, we can use the Ashwagandha Chur, Ashwagandha Arist, and lot of there is an antidepressant drug in Ayurveda. Now, the treatment for breathing problems, we can use this for treating the breathing problems, the yogas, for example, inhale and exhale. Now, the neuralgia. Next, this is neuralgia. Neuralgia is a pain in one or more nerves caused by change in neurological structure or function of the nerve. The term neuralgia is say that there is a pain in the head due to there is some problem in the nerve, in the brain. That is the neuralgia. Neuralgia falls into two categories: central neuralgia, where the cause of the pain is located in spinal cord or brain, and peripheral neuralgia. So this comes under the motor neuron disease. Neuralgia we cannot identify by this by seeing the patient. We can do different type of investigation like CT scan, MRI, according to modern techniques. Next, causes. What are the causes? In many cases, the cause is unknown. This is the important one. Actually, experience is best for these cases. Now, chemical irritation, diabetes, infections such as herpes zoster. Herpes zoster is a disease we can treat by the viral treatment. There is a unilateral opening in the body. Next is pressure on nerves by nearby bones, ligaments, blood vessels, or tumors, trauma including surgeries. Now, the post-therapeutic neuralgia and trigeminal neuralgia. Neuralgia and trigeminal neuralgia is a term which can use the trigeminal nerve. They are 12 cranial nerve, and in trigeminal neuralgia there is a pain in the cheeks. If we touch any object, there is a pain. Neuralgia are the two most common forms of the neuralgia. Neuralgia is more common in elderly people due to the decreasement of cells. There is a death of tissues that is come under the neuralgia, but it may occur at any age. But nowadays it can occur in any age. Either it is teenagers, either it is from old age. Thanks.